The purpose of today's video is to get an overview of what to expect from your first consultation with me. But more importantly, it is also to demystify and simplify some of the impressions that you may have about weight loss surgery. 9 out of 10 times when people come to see a bariatric surgeon, they have done some, if not extensive research on whether they see weight loss surgery as a possible solution to their specific weight issues. If you have not already done so, I'd highly recommend you do even a little bit of your own research, either on the internet or ask some families and friends who may have taken this journey, regardless of whether they eventually succeeded in achieving their health goals or not. See, you never lose by asking. For those of you who don't know me, my name is Dr. Arun Dheer. I'm a weight loss and a gastrointestinal surgeon, and I see myself an instrument of service. My intention is to help you not only achieve your health goals, but more importantly, develop the mindset that is required to achieve lasting success with the 4 weight loss procedures that we are going to be talking about today. See, having been a medical practitioner for over 2 decades, I'm convinced that health is our real wealth. You're probably already aware that sickness and disease not only take a mental toll on our finances, our physical well-being, but also impact our mindset and limit our growth. Each one of us has huge reservoirs of potential that we haven't even tapped into. We only need to direct our mind in a certain way, in a calm, relaxed manner with complete faith and belief, such that it starts to make that shift in our own selves. In this video today, I have covered the topic in reasonable detail. However, suffice it to say that weight loss surgery is only a tool that an individual needs to learn to address with a positive mindset to get its full benefit. In today's video, we will mostly focus on what we discuss at our first consultation. This video will only be just a basic introduction. However, it sets the stage for a sound understanding of what to expect, and it would perhaps inspire you to ask more pertinent questions such that you get the most out of your consultation with me. Just remember that the first consultation is not about locking in a decision. It is about gathering the information, getting to know the team, and organizing some assessments and investigations such that a well-informed, balanced decision can be made in due course. I say that the first consultation is really a fact-finding mission. So, when it comes to surgery, there are 4 key operations that our practice offers. All of these operations work in one of 2 different ways. First, it reduces the portion size of the food that you can actually fit into the new smaller stomach. But more importantly, it alters the hunger hormones such that you're not constantly hungry all the time. All these procedures are done laparoscopically using small keyhole surgical techniques under general anesthesia. So, the first procedure is that of gastric banding. This is also known as the lap band, and this operation had been very popular until a few years ago when we started to discover that there are a lot of maintenance issues that started to crop up as the years progressed. This could mean issues with lap band tubing getting broken, the band getting slipped itself, or simply food getting stuck in the band at repeated intervals. That being said, the band has been in place for several years, and it is still quite a reasonable option for individuals who are in that lower BMI range from 30 to 32. The key advantage of the band is that it can be adjusted and the fluid can be injected or removed to adjust its tightness. My opinion on the band is that it is a high maintenance device and creates lots of long-term issues that may need further surgery. Importantly, if you're looking for something permanent and relatively low maintenance in the long term, then the band is not an option for you. Also, if you experience extensive reflux or heartburn, then the band is going to make your symptoms worse. So it is important to bear that in mind. Alright, option number 2 is the gastric sleeve. This operation has become a hot favorite over the last decade or so. It certainly has some great things going for it. The operation itself involves removing 60 to 70% of the stomach over a calibration tube such that we know exactly the amount of stomach that is being left behind, as that is the most relevant part. The gastric sleeve functions by not only reducing the size of the stomach, but also removing the part of the stomach that produces the hunger hormone ghrelin, thereby significantly reducing your appetite. The operation of gastric sleeve is great for individuals who are struggling with portion size control. One of the key things that people notice after the gastric sleeve is that they have to remind themselves of having food at meal times. While this is a good problem to have, the secret of getting lasting success with weight loss surgery and with sleeve is to ensure that you are having small, healthy and regular meals in the day. Of course, our dietitians will educate you more on this. The gastric sleeve is a permanent procedure and does not involve any placement of foreign bodies like the lap band. However, there are certain risks associated with the gastric sleeve, and one of the unique ones is that of leakage. If the staple lines do not heal properly, which can be if individuals continue to smoke or are on medications that suppress the healing, the stomach contents can leak out and create infection, which can be potentially dangerous. This may need further interventions and procedures based on the clinical situation. The other side effect of the gastric sleeve is the new onset of reflux symptoms in certain individuals. The percentage of patients having a gastric sleeve who develop these heartburn symptoms is in the range of 7 to 19% in different studies. So, if you are already having pre-existing heartburn or reflux, you may need to consider another form of weight loss surgery like a gastric bypass. Having said this, the one appealing thing that I really love about the gastric sleeve is that it maintains the natural flow of food through the gut, as in the food goes from the food pipe into the stomach and then into the small bowel without any alterations as we see in the bypass. My opinion is that if you have difficulty in portion size control but generally eat healthy, you do not suffer from heartburn and are looking for a permanent procedure without any foreign bodies, then gastric sleeve is worthy of your consideration. The next two procedures I have clubbed into one description, and that is of the gastric bypass. Now I'll try and discuss both of these varieties of gastric bypass which I offer in my practice for sake of convenience, because there are a lot of similarities between these two. These two procedures are the traditional Roux-en-Y gastric bypass, as you can see in the image, and the relatively new mini gastric bypass. Both the gastric bypass operations involve making a small pouch of the stomach and attaching it to the small bowel such that it creates an element of restriction because of the small size of the new stomach, and reduces the contact between the food and the small bowel, which is what alters the hunger hormones. Any form of bypass, either the traditional or the mini gastric bypass, is a great revisional operation as well. What I mean by this is that if you've had a lap band previously or a gastric sleeve and have not achieved the desired weight loss or have developed some new problems, then a gastric bypass is an excellent choice of revisional surgery. The bypass is also a great option if you're struggling with not only obesity but also have diabetes, or your BMI is above 45, where you need a procedure with a strong impact. So let us find out what is the difference between the Roux-en-Y gastric bypass and the mini gastric bypass. To put it very simply, the traditional gastric bypass has got joints between the stomach and the small bowel, and the other between the two ends of the small bowel. The mini gastric bypass, however, has got only one joint, as you can see in the image. Less the number of joints, less is the risk of bleeding and leakage. These are the two key things that we worry about in individuals after weight loss surgery. My opinion, if your BMI is above 45 or you have problems with diabetes associated with obesity, then a gastric bypass is a great choice. If you have severe heartburn, then a traditional Roux-en-Y gastric bypass is a better option. However, if you do not have any heartburn, then a mini gastric bypass could be considered. The advantage of the mini bypass is the one joint and a small chance of internal twist in the bowel at a later date. I hope that the information I have presented here will be of some use in helping you get ready for your forthcoming fact-finding consultation. It is very important to understand that the process of change begins with creating awareness. And all the information that you are gathering in this process of researching about your weight loss surgery is actually increasing your awareness. And better awareness will help you make a better quality decision. If you need to know more about any specific questions that you may have, I'd highly encourage you, if you haven't already done so, to book an obligation-free telephone consultation with our client care coordinator, or join us for one of our free events, the webinars, or any of the live events that we do. I wish you all the very best and look forward to seeing you soon. Thank you.